morning, everybody. Respected Director of the college, Dr. M.G. Jite, and the Principal of the college, Dr. V.C. Gore, and respected Professor Akhilesh Khan, Emeritus Professor and Coordinator of this program, and all the participants from different colleges, my colleagues, my dear students. At the outset, I pay my gratitude and thanks to the organizer for inviting me just to share my experiences to the learned homeopathic fraternity and the new generation of homeopathic doctors from different parts of India. My today's topic is applied part of Materia Medica. Just I do like to share my screen. It will be good to understand the things. I am very grateful Dr. Professor Akhilesh Khan invited me to share my views. So, today's topic is applied aspect of Materia Medica in daily practice. First of all, I do like to pay my gratitude to Mahatma Gandhi. I know that this college is running in the ideology of Mahatma Gandhi. What Mahatma Gandhi told about homeopathy? Homeopathy cures a larger percentage of cases than any other method of treatment and is beyond doubt.
Dr. Julie Sung has joined from China. Welcome, Julie.
Okay, Julie, come.
Welcome.
Yes.
Julie Sung is joined from the China, from the south part of the China.
Okay, namaste. Most welcome, most welcome.
Julie, please open your video. Julie Sung has joined with us.
Whether I am continue now?
Please continue. Julie, please stay. Otherwise, Julie is here actually.
Okay, namaste. No, most welcome, Dr. Julie.
Dr. Julie from China.
Yes. Most welcome.
Julie, please open your video. Are you feeling problem now, Julie?
Homeopathy cures a larger percentage of cases than any other method of treatment and is beyond doubt safer, more economical, most complete medical science. And what Charok Sangita said.
Thank you. Yes. Okay, thank you.
Most welcome.
Okay. Listen, stay with us. Julie, stay with us. Our speaker from DL Homeopathic Medical Kolkata, he is telling, he is presenting his presentation. You stay with us. Okay. Good morning.
In Charok Sangita, yes, namaste. In Charok Sangita, we are getting regarding right medicine, that alone is right medicine which can remove disease. He alone is the true physician who can restore the health. Hahnemann said very correctly in his Organon of Medicine, in the perspective of physician's missions in homeopathy as a homeopathic physician, he said, homeopathic physician is subject to restore the health. Now regarding applied Materia Medica, I am taking the honor to share one of the beautiful quotation from Farrington. If he had not the idea of that remedy in his mind, he could not see it in his patient. That is the fundamental thing for applied Materia Medica. Whatever we are going through during our student life, even during our daily practice, unless or until that thing we do not see in our patient and not matching properly, the total effort to go through Materia Medica will be nullified. When you simply start to study Materia Medica, it seems that symptoms of different medicine are very ambiguous and similar to some extent and hardly make any difference between them. Materia Medica ought not to be only read out, but also would be studied at clinic. Whatever we learnt in our student life, Materia Medica, whatever we learnt in our student life, unless or until we studied in our daily clinic or daily practice, in Hahnemann's initial practice, what Hahnemann said, now if it is wished to describe a complicated case of a disease consisting of many symptoms in such a circumstantial manner, that the reasons that influence us in the choice of the remedy shall be clearly revealed. This demands a multiplicity of details fatiguing at once for the describer and for the reader. Hahnemann himself in his early life told to take a case is a fatiguing one. Not that, moreover, he also said in Organon, it is laborious, sometimes very laborious, search for and selection of the homeopathic remedy. Hahnemann himself told, to select a remedy is laborious, most suitable in every respect to each morbid state or facilitating it, still demands the study of original source themselves. If the truth be told, it is imperfection consists in this, that the most suitable homeopathic remedy for each morbid condition does not spontaneously fly in their mouth. So, in every case, whenever we like to select a correct remedy for any given case, we have to match the knowledge of Materia Medica, what is in our mind, with the clinical manifestation and the totality of the symptoms of the patient, whatever we are getting during our clinical practice. Homeopathy, what Bonning-Hoshen said, homeopathy can only promise a gentle, sure and permanent cure where it is enabled to oppose to disease that remedy which corresponds with greatest similitude. That is another thing. In applied part of the Materia Medica, we have to search out a remedy with greatest similitude to all its perceptible symptoms. He said, pain should be started with any type of sensation, namely boring, burning, bursting, heat, cold, etc. So, if we go through and open the page of the repertory, in the head chapter under pain, there are lots of remedies we are getting. But whenever we are giving some characteristics features, peculiar features with character of pain, then the number of medicine will be minimized. Likewise, whenever we are examining any patient and trying to select any medicine, in that manner, we should consider the patient symptom from different uncommon peculiar aspects, and especially Bonning-Hoshen advised it should be considered from location, sensation, concomitant and modalities. He also said cough should be completed in a different manner as to quality with or without expectoration, whether it is husky or hollow. So we are not supposed to make a list of medicine only under the heading of cough from the page of repertory. We should put all the peculiarities, different type of sounds, the character of expectoration, everything, then we will get the medicine. Regarding mental disposition, may be enumerated with its peculiarity like cheerfulness, hastiness, indifferent attitude, depression, despairiness, everything. Herring introduced so far complete Materia Medica in the history of homeopathic system of medicine. And he said in the preface of its guiding symptom, I has been made my rule through life to accept anything as true unless it came as near mathematical proof as possible in its domain of science. What he did actually, he collected symptoms from different sources, from proving records, from clinical Materia Medica and different sources. But every symptom is being verified clinically, and accordingly he put marks in his gradation in Materia Medica. So, whenever we are in confusion in our daily practice, whether this symptom is to be properly matched with that remedy or not, for reference, the book I like to name is Herring's Guiding Symptom. In a nutshell, now I am concluding the part whenever actually entering the applied part of the Materia Medica. The first collection of symptoms of which the homeopathic Materia Medica is composed is incomprehensible without an understanding of. Four things is to be required to understand or comprehend the symptoms of the Materia Medica, whatever written in our Materia Medica book. First, the principle upon which it is based. We should know the homeopathic principle. If we do not know the homeopathic principle in proper way, we are not supposed to comprehend the symptom of the Materia Medica. With the meaning of symptom, we should know and interpret the exact meaning of the symptom, their method of classification and interpretation. No imagination and hypothetic imagination is not to be imposed in Materia Medica symptoms. The fourth thing is very important. The principles, law of similia, law of drug proving, theory of dynamization, everything is to be remembered whenever we are selecting a remedy. Then in particular, whenever we are getting any information, any literary meaning of the words from Materia Medica, we should know the method of classification of symptom and the interpretation. J.T. Kent said beautifully, J.T. Kent appeared to individualize a case or remedy through a portrait. Law of similarity reduced to match disease personality with drug personality. What we are to do in our daily practice? Nothing more. We should know the drug personality from particular, from mental journals, from physical journals, and from different aspects what we are getting in a Materia Medica, and then we have to match with the person who are suffering from any disease. In that perspective, actually, I would like to say, in our Materia Medica book, we are getting lots of symptoms in schematic form, mind to skin, in narrative form, in pictorial form. But actually, what we are doing in our daily practice, we are taking first the chief complaint of the patient, then we are taking the past history, then we are taking the family history, then personal history, then physical generalities, mental generalities, and pathological finding, if any. And considering all, we are framing the totality and like to understand the mathematic background of the patient and the medicine from Materia Medica. So, if we like to rearrange our knowledge of Materia Medica in that manner, in that scheme, first we should know the special pathogenesis of the medicine, that is the chief complaint whatever the patient are telling. Then we should know in this medicine whether is there any respective past history should be considered. Likewise, in case of tuberculinum, we do like to have, if we get it, past history or family history or tuberculosis. Even in like calcarea carp, if we get the past history of old sprain, calcarea carp would be a good remedy. Likewise, if we get suppression of skin disease in early childhood, serenum would be a very good medicine for a patient. In case of selection of causticum, if we get in past history of burn, that would be a very good clue for causticum prescription. Likewise, for every medicine, especially for anti-miasmatic, deep-acting constitutional medicine, we should like and we should note the important point favoring the medicine as past history, what past history this medicine belongs to. Next point is family history. In most of the constitutional medicine or the anti-miasmatic medicine having significant family history. Just I am giving a few examples. A patient, a young boy, a young infant rather, 1 or 2 years boy or girl came to our chamber with few complaints. Whenever we are asking about past history and family history, in that point we also inquire about the gestational history. If we get mother suffered from preeclampsia or eclampsia during pregnancy, then with the presenting totality, if we get the gestational history of suffering from eclampsia, preeclampsia, thyroidinum would be a choice of remedy. Likewise, every medicine, whatever we learnt earlier, should be reframed, reorganized in the case-taking format, and that would be the applied part of Materia Medica. Kent said, memorizer have no perception. So, if anybody only to memorize the symptoms of Materia Medica with full stop, comma and semicolon and non-punctuation marks, Kent said, memorizer have no perception. And Hahnemann said, without perception, we do not go forwards. So, to get the perception about any medicine, memorizing is not the thing. They can remember what they use only on the surface. So, whatever we learnt in our student life or daily, whatever we are going through, unless or until we are seeing those symptoms in our patient, in our hospital, in our clinic, the perception would not develop. Memory is not knowledge. Until it is comprehended and used, then grows the ability to perceive. There is no royal road of perfect understanding of Materia Medica. The Materia Medica can be learned by careful study, not mere go through. Study like research work. Whatever you learned, you study at your clinic and by using it. So, regarding study of homeopathic Medica, Dr. Clark also said very beautifully, there is no royal road to the practice of homeopathic, whether it is the clinical road or the symptomatic road, which does not entail close and constant study of our Materia Medica. So, the thing we should remember, we have to study continuously Materia Medica, whatever would be our age, whatever would be our practice experience, and whatever we learn daily, that should be matched in our daily practice. There are lots of source books actually I am presenting in a slide. The books so came forth are also seen dealt with in a complex manner and diversity of approach, which render difficulty to master the subject. The textbook, source Materia Medica, have an account of a huge amount of information that is not humanly possible to memorize, even a single medicine. Whatever be the intelligence anyone possesses, it can only be comprehended or perceived. We must feel the dignitary personality of the patient as well as the dignitary personality of the medicine. Whenever anyone wants to acquire sound knowledge about a drug, the only way is to learn and consequently comprehend it. No medicine can be memorized solely, but we can perceive it by our reason-gifted mind, and as we feel and recognize our beloved friends among a group of people by their individuality. Every medicine is to be known by its individuality. In other words, genius of that medicine. To recognize a known person, we are considering a central idea behind the person. Likewise, to recognize a patient, we should consider the central idea or perception about a medicine. Moreover, different type of cases are present, symptom in different manner. There is no single Materia Medica is absolutely sufficient or complete for each case. To accomplish about a medicine is as good as to have an acquaintance with a man. On first visit, one can gather only an overview about a stranger, hardly know his personality. It requires repeated and continuous accompaniment and interaction. The essence of homeopathy based upon the concept of individualization. So to study Materia Medica involves nothing but the path how to approach homeopathic Materia Medica. Materia Medica is the result of experience by men, upon men and for men. Apart from that, in our daily practice, in our clinic, in our hospitals OPD and in our IPD also, we are getting mostly two types of patients. One group is acute, another is chronic. I am not going in detail regarding epidemic, sporadic, all those things. Individual acute disease and chronic disease. For acute disease, we are supposed to prescribe a medicine with acute totality, what Hahnemann advised in Organon of Medicine. For chronic disease, we are to prescribe a medicine considering the totality of the symptom, from considering the fundamental cause, physical genetics, mental genetics, and uncommon peculiar symptoms, if any, even with the pathological state of the patient. Considering all, we have to select. So, whenever we like to get acquaintance in medicine and like to prescribe in acute state and like to prescribe in chronic state, the approach should be different. To frame acute totality actually, we should know location, sensation, concomitant and modalities. So, whatever medicine we are learning in our from our Materia Medica, for acute case, we should consider all those particular symptoms under 4 headings. If we consider in that manner, then the prescription would be more easy. Just I am giving one example. If a patient comes to a chamber and telling, I am getting an exposure of scorchy heat and then after that I am feeling headache, and especially I am getting a very dull headache in my frontal region and I would like to press it very tightly, and actually I would like to be very quiet, open and like to lie alone, and at the same time I am also very thirsty. Hope all of you get the name of the medicine from the demonstration of the case. But what actually I told? First the causation. He got the exposure of scorching heat. Then I told the location, headache. Then I pointed out the location particular, frontal part. Then I told about the modality, sensation, along with accompaniment, modalities. All those things. Whenever we go through bryonia, then in that manner we should prepare ourselves. For any disease, for acute totality, whatever we learnt in our student life, the Materia Medica part, our knowledge part, should be reorganized under the heading of location, sensation, causation, concomitant and modalities. And that would be better and easy for prescription. Even in simple fever cases, we are failing in our daily practice, as we are not considering the different stage of fever, what are the symptoms. About 15 or 20 days ago, one of my ex-students, postgraduate students, he is staying at Jharkhand, Chhattisgarh. He is working there. He was suffering, suddenly he was getting severe acute abdominal pain and with high rise of temperature. Temperature rises about 102 and 3 Fahrenheit within 1.5 hours. I inquired, what about thirst? About your thirst? He said, sir, my thirst is not, I am very much thirsty. Suddenly I became very much, got pain and now I am getting chilliness, very much chilly. Then I prescribed over telephone, he took Pulsatilla 30 with 15 minutes interval for 2 to 3 times and report after 3 hours. And with utter surprise, he reported after half an hour, just after taking Pulsatilla 32 dose, with an interval of 15 minutes, the temperature subsides. Then he inquired at evening, sir, why you have prescribed Pulsatilla? If we go through Herring's guiding symptom, if you go through Bogar-Bonning-Ocean's repertory, concomitant and fever regarding thirst feeling, Pulsatilla, otherwise they are thirstless. But for that patient actually, during acute stage, the patient was very much thirsty. During chill stage, Pulsatilla is thirsty. It is in Herring's guiding symptom. It is in Materia Medica. So if we having an idea, in every case Pulsatilla patient would be thirstless. No, it is not correct. In chill stage, it is thirsty. Then in heat stage, it is thirstless. Likewise, from every point, we should meticulously search out from knowledge of Materia Medica and from repertory also. Whatever we do not know, we may search out from repertory. In that perspective, I would like to share you some points regarding relation of repertory with Materia Medica. Repertorization is an analytical method, but to perceive Materia Medica is synthetic method. Analytic means examining or tending to examining things very carefully, but synthetic means the mixing of different ideas, influences of things to make a whole thing which is different and new. In reality, we are mixed different particulars of a medicine, but in a different manner that unites logically and to make a whole, not merely numerical aggregate of the particulars, but the dignitary personality of the medicine, which is different or new as we get through study.